Hi everyone. So today we're going to talk about RNFA certification and if it is difficult to become an RNFA. And we want to preface this with educational requirements for nurses. It often changes. So we're going to give you the names of some resources that you should check to make sure there's been no changes to what we've said. Um, First of all, you can always check AORN. That's the Association of Perioperative Registered Nurses. You should check your state board of nursing because different states have different requirements. And you should also check the employing institution's requirements. So, whoever your employer is, you need to figure out what rules and regulations they have. And they're all of these institutions, AORN, your state board of nursing, and your employer, they'll have the most accurate guidelines and information. So, let's get started. So next we wanted to give you an overview of RNFA programs and what they consist of. So RNFA programs consist of usually a didactic and a clinical portion. And the majority of the programs are sort of a hybrid model where you may be going in for skill lab or something. There are a few programs that are entirely online, but the majority will require at least a day or two of hands-on skill training, if not more time in person. And then all programs require some form of clinical hours where you're working with a preceptor. And we'll talk a little bit more about that later in the video. Programs, the length that it takes for you to complete them, it varies based on how quickly you can get through your clinical hours. So it usually takes between 12 and 18 months. And let's talk about program requirements. AORN has set forth some specific program requirements, and then your individual programs will also have requirements. So you want to make sure you're checking with your individual program. So some RNFA programs the requirements will vary a little. However, all programs require that you be an RN or an APRN with an active and in good standing license. You need, if you are an RN, you need 2 years of OR experience, and that is possibly waived if you're an APRN. The requirements are a little different. If you're an RN, you need CNOR certification, or you have to at least commit to finishing your CNOR certification before the end of the program, and that again can potentially be waived if you're an APRN. You're going to need a BLS, ACLS certification. You're going to need for most programs, for the clinical portion, you're going to need evidence of professional liability coverage, and you'll need letters of recommendation, usually from surgeons that you've worked with or a professional reference of some sort. And these are just some of the common universal requirements, and like we said, requirements vary slightly depending on if you're an RN or an APRN. So what does RNFA didactic focus on? RNFA didactic focuses on giving you information based on best practice and evidence-based practice, and some of the key topics that you go over in RNFA didactic will be sterile technique and asepsis, wound healing enclosures, tissue handling, patient positioning, prepping, draping, safety and communication, surgical procedures and techniques, and that usually includes some sort of anatomy review as well. These are just key topics. There'll be variation, and there may be other things that you discuss that aren't addressed here. One thing that we wanted to mention was there is a very good chance that you'll be turning in assignments and potentially writing papers, so it's a really good idea to become comfortable with your institution's desired writing format and to become comfortable performing research reviews. And no matter how poorly you think you did on an assignment, always turn it in, because a lot of these instructors, they understand that we're working professionals. So there may be a chance, depending on your institution and your instructor, that you can go back and revise an assignment. So even if you think the work isn't exactly what you would want to hand in, just turn it in anyway. And at this level of learning, it's more of a collaborative learning style. So if you have the opportunity to become friends and network in your RNFA program, it's always a good idea to do so. So next we want to talk about what skill labs focus on. Skill labs are your opportunity to obtain the hands-on skills necessary to properly assist in surgery. So these are key skills that RNFAs will need to be successful. So these are some popular topics that you may get to perform in the lab. Suturing and knot tying, that's always really, really popular, and we recommend that you don't just practice that in a skills lab, that you also practice it at home. Obtaining hemostasis, there's so many different ways to obtain hemostasis. It could be with monopolar, bipolar, clips, ties. So this is an opportunity, if you have a skills lab on this, to explore some of the different techniques. Minimally invasive instrumentation and portal placement, and this can include instrumentation or portal placement for laparoscopic, arthroscopic, or robotic procedures, positioning tools and techniques that you'll be using in the operating room, and prepping and draping. So next we wanted to talk about clinical hours. I want to preface this with saying that different programs will have different requirements for clinical hours and how you log clinical hours, so you always want to make sure you're checking with your program-specific requirements. But in general, clinical hours are your opportunity to, as a student RNFA, to operate side by side with a mentor. And usually this mentor is a surgeon mentor, although sometimes you'll be able to operate with other RNFAs. Generally you have one surgeon mentor, but you can operate with a variety of surgeons. And obtaining the surgeon mentor is typically your responsibility, although there may be some programs that help you find a clinical site or a clinical surgical mentor. And my recommendation is that, if possible, you try to obtain a variety of different clinical experiences while you're on clinical, so that you get to see as many surgeries and as many different surgical techniques as possible, although you always will be referring back to that surgeon mentor. And finally, we wanted to just kind of give you a summary of a personal experience. So the person I host this video with, Angela, we wanted to give you the summary of her experience. So Angie chose a program, she's an RN that was working in the operating room, and she chose a program that was 1 semester of a didactic and 1 semester of a clinical. So she found a mentor surgeon at the hospital that she worked at, and she did clinical hours on the days that she was off. And she did first, it was a hybrid program, so she went in for 1 week of skill labs. She did her didactic primarily from her home, turning in assignments, and then she did a semester of logging her clinical hours with the surgeons at the institution that she worked at, and with her clinical mentor, who was one of the surgeons that she worked with on her day off, or her days off she would go in. And we want you to share your experiences with us, especially if you are currently in RNFA, what you did for your clinical hours. And we also want you to comment and let us know other things that you'd be interested in learning, or if we can answer any questions on what it takes to become an RNFA. Okay, thank you.